this point, the first intended learning outcome was covered. Now it's the time to cover the second intended learning outcome, which is to recognize the conditions that mimic cancer. Conditions that mimic cancer or that are like cancer at presentation. For example, fever. Of course, you would think of infection anywhere in the body may explain fever in children before you think of leukemia or lymphoma. Vomiting that occurs in infection again or gastroesophageal reflux disease resembles abdominal mass or increased intracranial tension due to a brain tumor. Constipation may occur with poor intake, poor diet, and this could be verified by simply a dietary questionnaire. Before you think of an abdominal mass causing obstruction of the pathway. Cough frequently occurs due to upper or lower respiratory tract infection, and if persistent, you would think of a foreign body or a reactive airway disease. Before you think of a mediastinal mass causing obstruction with respiratory distress and persistent cough. Bone or muscle pain. Children are very vulnerable to trauma, so musculoskeletal injury would explain acute onset of muscle or bone pain. Viral myositis is not uncommon. Before you think of leukemia or a primary bone tumor or secondary due to neuroblastoma. Headache as a manifestation of increased intracranial tension and brain tumor occurs frequently and is a very common finding due to errors of refraction or an ENT problem or hypertension, for instance, sometimes due to migraine, which runs in families, infection elsewhere in the body, especially if accompanied with fever, and tension headache in elderly children occur frequently than to have a brain tumor. So although it is the second most common cancer in children. Lymphadenopathy, which occurs in leukemia, lymphoma, and in metastatic diseases, occur frequently due to non-specific lymphadenitis or systemic infection like cytomegalovirus or Epstein-Barr virus, or might occur with collagen vascular diseases like systemic lupus erythematosus. Hematuria occurs frequently due to urinary tract infection, urolithiasis or stones, and with glomerulonephritis more common than to have a Wilms tumor. Voiding difficulty occurs frequently due to congenital urinary tract infection more than to have rhabdomyosarcoma in the pelvis obstructing the pathway. Collective symptoms suggestive of cancer, like, for example, pallor, fatigue, and malaise, all occur in iron deficiency anemia, which is the most common type of anemia in developing countries. But again, it might occur with cancer like leukemia, lymphoma. Weight loss expressed as loss of 10% of the body weight in 6 months. In presence of night sweats, drenching night sweats, wetting the bed, or itching. These might occur frequently in infections like tuberculosis or viral infections. But again, Hodgkin lymphoma is important to exclude because, as you know, Hodgkin lymphoma is classified into group A or B according to presence or absence of the systemic symptoms in terms of weight loss, night sweats, and itching. Careful clinical examination permits early diagnosis of childhood cancer. You don't have to wait until anemia is so severe as in this photo. Asymmetry of the neck. As early as possible, you should refer the child for diagnosis and exclusion of cancer. Like this one, again, asymmetry of the neck. You don't have to wait until the disease is so extensive like this patient. Asymmetry of the abdomen, denoting organomegaly or a mass. Limping, or asymmetry of the joint and the periarticular tissue, like this. Generalized enlargement of the abdomen, especially if associated with bleeding in the skin and subcutaneous tissue, as evident in the patient on the left side. Eye changes in the form of the white reflex, very common for patients to be diagnosed during photography for any reason. A patient with neuroblastoma would present with the white reflex. As you see, the arrow points to the normal red reflex, and the other eye with a white red reflex called cat's eye. This child is having infiltration of the eye and the surrounding tissue by neuroblastoma cell, although it can be misdiagnosed as having trauma to the eye.